Welcome everyone to the University of Rochester Cardiology Fellowship.
Hi, I'm Ritika. I'm one of the second-year cardiology fellows. So we're right next to our EP and cath lab. So right across from our cath lab is our cardiology administrative offices. So right through here, we have some of our administrators here. And when you come down this way, we have two of our conference rooms. This is where we have most of our education. The smaller conference room for some of the smaller conferences, but this is our big conference room for morning reports and various other lectures. So.
Hi, my name is Mohamed. I'm one of the second-year general cardiology fellows. I'll be giving you a tour of our workroom. So this is the fellows room. Each fellow gets their own individual workspace, and each person can customize the workspace as you see fit. Each fellow also gets a laptop provided by the program. On this side, we have a kitchenette. People can store their food, heat it up. The TV and laptop where we can have conferences held in the room, an interrogator, couch to relax. And the nice thing about the room is that actually the general fellows, the EP fellows, and the IC fellows are all in one room. So you can always bounce ideas off of one another. So that's the fellows room.
Hi everyone, I'm Lafon. I'm one of the second-year general cardiology fellows. It's nice to meet you here. We're here at the University of Rochester, and we're in the control room of one of our electrophysiology labs. Our EP service is a very robust service. We have 9 inpatient EP attendings and 3 labs that are running every single day during the weekdays as well. We have a very robust heart failure program here, and because of that as well, we also have a lot of very interesting pathology in our labs. We do everything here, including Watchman devices, of course ICDs and pacemakers, and high-risk lead extractions as well too. The support staff here are absolutely wonderful. The EP attendings are really accessible to chat with about any sort of problems we have. We also have really great device reps who are available basically 24/7, even overnight, to help us out with any questions we have regarding device interrogations. We also have device interrogators both on the floors here in our EP labs as well as in our fellows room too. So it's a great program if you're ever interested in electrophysiology. We have great pathology here, and all the attendings will help you out to get great training from our end here.
Hi everyone, my name is Keshav Patel. I'm one of the first-year cardiology fellows.
And I'm Jeff. I just finished general fellowship here, and now I'm an interventional cardiology fellow.
Yeah, so I can tell you a little bit more about our fellowship and our cath lab experience. So in the first year, you get to spend 2 months here, and I can honestly say that it's an amazing time. You get to learn a lot, and you have a lot of fun as well. Starting from day 1, you get access, you get to engage the coronaries, you basically get to do all parts of the procedure. And as you get more experience, you get to start doing PCIs as well. And interestingly, our third-year fellows actually take STEMI call as well. So I think it's overall a great experience. I feel like because we're such a big hospital and there's such a large catchment area, we have a unique opportunity to take care of like really complex and sick patients. And we get a lot of patients who receive lytics at outside hospitals and then undergo their catheterization here.
Yeah, and if you're interested in interventional cardiology, we have a really strong and robust structural program. You learn a lot about TAVRs, MitraClips, all kinds of things that you do if you want to become an interventional fellow. And because we are a high-level shock program here, we're putting in tons of Impellas, ECMO, balloon pump, pretty much whatever you can think of, we do here. So it's a really awesome place to be if you have any interest in both critical care cardiology and interventional cardiology.
Hi, I'm Kimmy. I'm one of the second-year general cardiology fellows. We're here in our Echo lab. This is one of our TEE rooms. We do several TEEs every day, Monday through Friday, for both inpatient and outpatient. We do TEE as a second year. And then over here, we have usually a bunch of ultrasound machines that are parked over here. During the day, we have sonographers that are doing echoes throughout this hallway. There's 5 rooms for both inpatient and outpatient TTEs. And then we also have some sonographers go upstairs onto the floor to do portables for patients that can't come down here. And then you just go a few steps farther. We have our echo reading room. During the day, during the week, there are attendings that are always in the echo reading room. They're reading echoes, and then fellows can just come by and read with them for a little bit. We just have some of our attendings here, just reading during the day.
Hey guys!
It's Dr. Wu, Dr. Vornovitsky, and Dr. Rao.
Hi, I'm Malcolm. I'm one of the first year cardiology fellows here at the University of Rochester Medical Center, and we're currently standing in our 434 unit, which is the advanced heart failure unit. And here we get to take care of a lot of patients that are here for acute or chronic heart failure, but as well as patients with LVADs. And as we are rounding in this unit, the fellows really get to take on an excellent junior attending role, and you really get to make a lot of the impacts that are seen with the patients on a day-to-day basis. And our attendings are absolutely amazing, and it is a rapidly growing program, and that a lot of the attendings have been able to provide excellent education, but also the program has recruited attendings as well that are new and bring a lot of great insight and teaching to the program. So I think this is truly an amazing place to learn about heart failure.
Hi, I'm Sneha LeMay. I'm one of the third-year general cardiology fellows. So this is the critical care bay part of the Strong Memorial Hospital. We spend a lot of time here on call both during the day and on nights. When you're on heart center during the day and at night when you're on call for everything, you're part of the MI response team. So that means is when a STEMI is paged out by EMS or within the hospital, it's your job to come assess the patient first and confirm if it's a STEMI or not. You make this decision with the heart center attending who's on call with you. So a lot of the time when we're assessing these patients, we use the POCUS machines available in the ED, both here and in the kind of general ER rooms. That being said, it's not a dedicated echo machine. If you want a more detailed assessment, there are plenty of echo machines available in our echo lab. On nights, you can bring one along, pop in an order, and then the images will be uploaded for the attending and yourself to review that night or the next day. So we're mainly looking for wall motion there. Here at Strong, we have a very large catchment area, getting a lot of patients with STEMIs, high volume, and those who are post-lytics. So that's another thing that adds into our decision whether to take them to the cath lab or not. If you do confirm the STEMI, then you accompany the patient when you're on call to the cath lab and see what intervention gets done. Depending on how the patient's doing, they'll either get admitted to your service, the heart center, or 428 or the CTICU. I think that's about it. Critical care bay.
All right, hey guys, my name is Piotr. I'm one of the first year Gen Cards fellows, and I'm meeting you here in the Cardiac Intensive Care Unit, or CVICU, or 428 as it's labeled in the hospital. So, us being the only heart transplant center outside of New York City, this is where we get to see a lot of our sickest patients. What that means for you is this is where our post-CABG patients come through, our post-transplant patients, post-valve, and our really sick MI cases. This is where a lot of the MCS learning happens. So this is where our intra-aortic balloon pump patients are, this is where our Impella patients are, this is where our ECMO patients are. You will, as a fellow, work with our dedicated cardiac intensivists as well as the cardiothoracic surgeons. And a lot of what you provide on rounds is the cardiology-specific expertise. What that means is you're involved in a lot of the management decisions when it comes to hemodynamics. You're involved in the bedside echoes to verify Impella placement, as well as doing any bedside procedures that need to be done that day. It ends up being a very fun rotation. You work a lot one-on-one with the cardiac intensivists, and this is where you can really hone your skills when it comes to these sick patients.
Thank you for considering the University of Rochester, and we all hope to see you next year.